Okay, so this is the chapter on trauma. It's part 2, and we're going to start with bites. An insect bite is a puncture of the skin by the bite or sting of an insect, which could involve the injection of venom into tissue. Common biting insects are fleas, mosquitoes, lice, mites, and spiders, and common stinging insects are bees, wasps, and hornets. Rocky Mountain spotted fever is a serious infection carried by ticks. Now, the tick vector is the family Ixdidae, Ixdidae. The infection is caused after a prolonged bite of 4 to 6 hours. Symptoms begin to manifest several days after the bite. They get a spotted rash, which is also called a maculopapular rash. It's caused by Rickettsia and transmitted by the woodpeck. This Rickettsia is a small gram-negative aerobic coccobacillus, and it's an obligate intracellular parasite. It means it needs a host. So this is a picture of the rash on the hands and forearm. Okay, and this is what the little organism looks like. You notice it's inside the cell, so it's an obligate intracellular parasite. Okay. The rash starts on the hands and feet and later spreads to the trunk. This is zoonosis, which is a disease of animals that can be transmitted to humans. Insect bites. Malaria is a severe generalized infection caused by the bite of an infected Anopheles mosquito that is infected with a Plasmodium type of protozoan. Now, this little thing right here, if you can notice that, it's got like a little clear area. This is called Laveran's bib. It's a gametocyte. This particular one is Plasmodium falciparum. And these are sporozoans found in the blood of humans. There are 4, you will not be tested on this, but just FYI, there are 4 species of Plasmodium that infect humans. So Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium falciparum. Animal bites is any bite inflicted on an individual by another animal. Sources are other humans, domestic pets, or wild animals. This particular one is a dog bite. Snake bites are a penetrating tissue wound made by the fangs or teeth of a snake. There are 4 kinds of poisonous snakes are known to inhabit the United States. Rattlesnakes, copperheads, and water moccasins, and these are known as pit vipers. There's an opening on each side of the head between the eye and nostril, and then coral snakes. Oh, and these just nasty, nasty, nasty. So this western diamondback is native to North Texas, and these coral snakes are found in the southeast portion of Texas. So y'all remember the little jingle, red next to black is okay for Jack, red next to yellow right here will kill a fellow. All right, the next section is on cumulative trauma. These are also known as repetitive motion injuries. They're a group of muscular conditions that result from repeated motions performed in the course of daily activities. These are repeated, unnatural, or awkward movements such as overextension, twisting, or muscle fatigue. First one is carpal tunnel syndrome and results in entrapment and compression of the median nerve in the carpal tunnel. It causes pain and numbness in the wrist, hands, and fingers. Okay. So these all pass through the carpal tunnel, okay? And then then you have inflamed, you see where the tendons are? These tendons become inflamed and they begin pinching this median nerve. Now, the next one is tennis elbow. Specifically involve the areas where muscles and tendons of the forearm attach to the outside area of the elbow. which is the lateral humeral epicondyle. So this is also known as lateral humeral epicondylitis. Okay. This mostly affects the dominant arm. Baseball players, bowlers, gardeners, landscapers, house or office cleaners, carpenters, mechanics, and assembly line workers can have this. And just FYI, golfer's elbow is the same process occurring on the inside of the elbow. So this would be the medial humeral epicondylitis with golfer's elbow. Trigger finger is an abnormal condition in which flexion or extension of a finger may be momentarily obstructed by spasm followed by a snapping into place. Causes difficult and repetitive finger movement of the index finger or trauma to the tendon. The treatment is the cessation of repetitive motion and rest. All right. So, tendons, excuse me, are white fibrous cords that attach muscle to bone. So right here, these are the tendons. Okay, guys? In here, it's in blue. They allow the bone to move when the muscle contracts. In the hand, the tendons run down the bones in the fingers and are attached to the muscles in the forearm. The tendons are held in place by ligaments, and that's this little red piece right here. These are ligaments. The ligaments form an arch on the surface of the bone that creates a tunnel for the tendon to run in along the bone. To keep the tendons moving smoothly under the ligaments, the tendons are wrapped in tenosynovium, which is a slippery coating, and this allows them to glide through the ligaments by reducing friction. Sometimes the ligaments swell or develop nodules. Tendons can no longer slide easily through the sheath, which is the ligament. The tendons can get caught in the opening of the sheath, and the finger gives a painful click like a trigger when it's straightened. So this is also known as stenosing tenosynovitis. De Quervain's disease. This is inflammation of the sheath that surrounds the extensor pollicis brevis, okay, which is the short extensor, and the abductor pollicis longus, which is the long abductor. And these two tendons control the movement of the thumb. They function in radial abduction, which is a movement of the thumb away from the hand in the plane of the hand. They have pain on the inside of wrist and forearm just above the thumb. To diagnose this, they have something called the Finkelstein's test. In people who have, they find this in people who have wrist pain. The thumb is placed in a closed fist and the hand is tilted towards the little finger. Pain will be noted on the thumb side of the forearm, approximately 1 inch below the waist. The thoracic outlet syndrome. This is a compression of the brachial plexus nerves. And this is a group of nerves that originate from the neck region and branch off to give rise to most of the nerves that control movement in the upper limb. There's swelling or scarring of the scalene muscle, and this causes compression of the vessels and nerve against the clavicle. Not verves, it should be nerves. The thoracic outlet is an area on both sides of the body behind the clavicle where an artery, vein, and a group of nerves cross over the first rib to continue down each arm. Problems occur when this area is compressed or made smaller. We also have tendinitis. It's an inflammation of a tendon that is usually caused by an insult or injury to the tendon and is usually accompanied by pain. Calcium deposits often are associated with tendinitis, and the bursa around the tendon may also be involved. Okay, now the last thing things we're going to talk about are physical and psychological assault trauma First one is child abuse and neglect. So physical, psychological, or sexual injury to a child is considered child abuse. Physical abuse is the most common. Neglect is also considered a form of child abuse. This is a reportable occurrence. Okay. We have shaken baby syndrome. This is a closed head injury with bleeding in the brain. It's caused by forceful shaking of an infant or toddler. Usually occurs when the caregiver becomes irritated or upset, loses control, and violently shakes the baby. And it can also be accidental. And the shaken baby syndrome, usually there is no outward indication of physical trauma. When signs are present, they include altered consciousness or unconsciousness, pale or bluish skin color, vomiting, lethargy, and convulsions. Repeated shaking causes infant's brain to continually strike one side of the skull and then the other. As a result, tiny blood vessels rupture and cause minor or major bleeding in and around the brain. These injuries can lead to permanent brain damage and possibly death. Then we have elder abuse and neglect is physical, psychological, or sexual injury to an elder. The most commonly observed form is physical abuse. Psychological and sexual abuse are harder to identify. So we have different forms: physical abuse, self-neglect, verbal abuse, psychological abuse, abandonment, violation of personal rights, and financial abuse. Psychological or emotional abuse is the intentional and systematic diminishment of another person's self-worth or self-esteem. Although emotional abuse involves all age groups, children are the most frequent victims. Intimate partner violence is the result of a pattern of behavior in which one spouse is repeatedly physically assaulted by a spouse. Women are more frequently the victims, and many have low self-esteem, believing they are unable to escape the behavior. Now, women can also be the abusers, even to the point of dismembering or setting their partner on fire. And this can also be referred to as domestic violence. Sexual abuse is any form of non-consensual sexual conduct or activity. Can be any age from infant to elderly. Some examples of sexual abuse are fondling of the genitals or breast, penetration of vagina or rectum, or forceful touch on or around sex organs. Physical rape, intercourse forced on the victim against his or her will. Rape is a crime of violence and domination, not a sexual act, and can occur to both females and males. It occurs when mutual consent has not been given by both partners involved in the sexual act. Situations vary. There's date rape, acquaintance rape, rape by the victim's spouse, and perpetrated by an unknown assailant. And guys, the thing to remember is the victim is not responsible. Okay? And that is it. Thank you.